I'm Dr. Sangeeta Sharma, Professor Head of Pediatrics at National Institute of Tuberculosis and Respiratory Diseases, New Delhi. My center is also recognized as the National Center of Excellence for Pediatric TB. So I'll be talking today about pediatric tuberculosis, that is TB in children. Children of all ages get TB. In fact, childhood is defined till 14 years in India, while WHO has now extended the time frame up to 19 completed years. But we are still following the age band up to 14 in majority of our hospitals. NTP has defined it to include up to 18 years. So your question was that whether children they suffer from tuberculosis or not. The answer is yes. The maximum risk of getting tuberculosis, there are two things. One is TB infection. Whenever a child is exposed to a person who has bacteria in their sputum, there are chances that these mycobacteria, that is MTB, they may be inhaled. So this TB exposed person now gets TB infected. And later on, depending upon your body immunity, it may change into disease. So the risk of infection flaring up into disease is maximum in young children, that is up to 2 years. Then the risk decreases. So there is a trough, and then finally again the risk increases as the child approaches adolescence. So children of all ages, they have tuberculosis. While as I've already described, the risk of dissemination and even the dangerous forms of tuberculosis like disseminated TB. By disseminated means that the bacillus has gone into the blood and it causes disease with tubercles and involvement of almost the whole body. That is what is called as the miliary tuberculosis. And the other dangerous form is tubercular meningitis. So these two dangerous forms of diseases and dissemination, the maximum risk is within 1 year of infection and in a child who is 2 years or younger. Any child any person in fact who or she has bacilli in their sputum, that is whenever even if the child is sputum positive with lung involvement, that is disease involving the lungs, and the bacilli, they are being expelled into the air whenever the child coughs or even speaks or even laughs or talks. So these bacilli, they remain suspended in the environment, and obviously any person who comes in contact will have the risk of catching the infection, as I told you, will not be exposed. So a child of any age who is sputum positive, that is has bacilli in their sputum, they have risk to others in the family. The majority in our country feel that children, they would not get tuberculosis. So I want these concepts to be very clear and straightforward, that child of any age can have tuberculosis. By drug resistance, we mean that the drugs which we are the anti-tubercular drugs. So a particular drug will not affect on the bacillus, that will not be able to kill the bacillus. And the two drugs which we are worried about, the number one drug is rifampicin and the second is isoniazid. These two drugs are the crux of the first line therapy. And by drug resistance, we mean if the bacilli, they are resistant to either rifampicin or INH or both. that is RR or MDR tuberculosis. And then there is add-on resistance to fluoroquinolones, we call as pre-XDR, and finally XDR, where there are group A other drugs. I mean, you don't need to discuss these details, but you need to just, I want the parents to be aware and the caregivers to be aware that children, they can have drug-resistant tuberculosis by, number one, if they can come in contact with a source person who is already excreting these drug-resistant bacilli in their sputum, or number two, if the child is not being given drugs in appropriate dosages or is missing his or her therapy or defaults. That means there is the child has a drug treatment for say for a month or so, and then there is a gap in the treatment. So these are the risk factors, and then obviously the risk factor is diabetes or HIV. So these are the various risk factors which we as clinicians, we are worried about, that these may lead to either drug resistance or dissemination of disease. So children of all ages, they can have drug resistant tuberculosis. It depends upon the stage when the child is brought in. When the child is into the system, into the health system, where there is protocol-based diagnosis and treatment. So because now the treatment is all protocol-based, the most important factor is when do the parents, they get the child. Unluckily, the children, they do not suffer from high fever, and it's they do have fever or cough, but there are a majority chunk who just have vague symptoms. That means the child is just lying lethargic, or the child is not interested in studies. Such vague symptoms may also be a cause of worry. So but otherwise the symptoms are cough and fever of more than 2 weeks duration, weight loss or loss of appetite. So the parents, they should be aware of these symptoms and they should get the child at the earliest. So as I highlighted, the most important is when the child is brought into the system. Number one, if the child is got late into the system, by that time majority of either it is disseminated disease or tubercular meningitis. So these are the dangerous forms of the disease. Obviously, then the chances of survival are less. The other thing is, if there are comorbidities, as I already said, diabetes, uncontrolled diabetes or HIV, then the chances of mortality, they are higher. Otherwise, we need to understand that tuberculosis is curable, provided, as I said in the beginning, that the parents, they need to understand that this is a disease which is 100% curable, provided you get your child diagnosed and treated at the earliest. Tuberculosis, as I said, it depends upon the stage when the child is gotten. There are two things which I explained to the parents, and I think I need to tell this even now. There are two different things. Suppose there is a leak in this wall, there is a water leak in this wall. So what it causes? It causes erosion of the plaster, as well as the wall gets weaker. So by treating tuberculosis, what we are trying to do? We are trying to stop the leak of water. But what damage has already been done to the lungs prior to the treatment is, most of the time, it's going to stay. So there are two different things. That is long-term morbidity. It all depends. Morbidity means that the residual damage or the sequel, they all depend upon the stage in which the child is got. As I said, tubercular meningitis is the dangerous most type of tuberculosis. but it's also curable, provided the child is got into the system early and put on treatment and adheres to the treatment. So all these things are important. I would just like to stress that, being parents, we have a social as well as moral responsibility, because we are the persons who have got these children into this world. So as a parent, I would say that we need to take care of our child, give him or her good balanced diet. So you don't need to buy expensive, or exotic fruits or vegetables. Just whatever is there in that season is enough, so that the diet needs to be balanced. By balanced diet, I mean that you need to even take care of the proteins. Children, they're sometimes fussy about milk. Try some other thing, give them eggs, because eggs are a good source of protein. Or if you are non-veg, so once in a while a non-veg would go a long way. Number one. Number two, always take care of salient signs and symptoms, which can, as I already said, they can be vague. So if your child is uninterested in studies or is lying lazy in the house, please, there is something wrong. Because our Nelson, which is a Bible of pediatrics, it clearly says that it's only the sick child, a very sick child, who lies on the bed. Otherwise, we are all aware that children, even with 101 fever, they'll be just playing around. So that is number two. Number three, get your child into the system. Now initially there may be 1 or 2 visits to the center, because now we have got such good diagnostics, and these take time, because the reports, they take time to come. So we should not be wary that why I'm being called again and again into the hospital. 1 or 2 visits is fair enough, and the parents, they need to cooperate, because what we are trying to achieve is microbiological confirmation. Because as a doctor, it's not important not only treat tuberculosis, but it is more important to know the spectrum which drug would be acting, as we've already discussed about drug resistance. So we need to be aware that, look here, these drugs, so these are the drugs which will be effective in this particular child. And number 4, as a parent, once the treatment is started, it's our duty to see that the child actually swallows the medicines in front of us. I would just like to share a sad story which has lots of lessons. I had a child who was not improving, and I got the test done 3-4 occasions. The test, they showed that the drug sensitive bacilli, but the child remained sputum 3+. So I used to always confront the mother that, are you sure that you're giving the drugs? She would say, yes madam, because she was a school teacher and the child would go with her to the same school. So she was very sure, कहती ma'am, मैं तो अपने सामने, I give these drugs with my own hand to the child. So that part was literally, I used to take her by the face value. So finally, unluckily for us, the child was deteriorating and the child died. So, after about a month, the mother comes back to me and she gets a pillow. And guess what? What was inside the pillow? The pillow was full of the medicines. So what used to happen was that the mother used to give the medicine to the child. So what the child was supposed to do? The child was supposed to swallow those medicines. But what the child used to do was, because obviously nobody wants to take medicines for a long time, because the therapy is for minimum 6 months. So what the child would do, would go, put the drug into the pillow, and the mother was very confident that she is giving the drugs. So please, my biggest take home message to the parents is that we have to work as a team, doctor and parent team. So my responsibility as a doctor is to diagnose properly and to start the most appropriate treatment. But you as a parent, your moral responsibility is to give the drugs, not only give the drugs, but also see that your child actually swallows the drugs in front of you. So this is the most important message which I would like to give to our parents.